I affirm.
I also affirm that we believe that it's necessary, so this is unanimous, and we'll proceed, City Manager, with our special presentation.
Yes, thanks. I think we've got two of the busiest men in Sullivan County here with us tonight, but I greatly appreciate Gary Mays and Dr. May taking some time to come in to update our board, update the citizens as to what has transpired over the, really, I guess, the last 24 hours. And so, Gary, I will turn that over to you and take the podium there.
Okay, thank you, Clark. Thank you, Mayor Shaw, and also the Board of Mayor and Alderman for allowing us to attend tonight. It's an honor to be here, and Mr. Cox as well. But before, if I may, Mr. Mayor, I'd like to note that we are protected by one of Kingsport's finest here tonight, and appreciate him being here, Officer Addington, and he comes from good genes, so he'll be a good
Yes, we're proud of him so far.
yeah. And thank you again, Mr. Carr, for inviting us. And of course, we're here to talk about COVID-19, and the status of it. And Dr. May is here with me as well, and we'll let him update you, give you a few statistics and numbers about the area and the state and disease status. But of course, certainly in the last probably 26 hours, the governor of Tennessee issued a press release, and I thank you, Mayor Shaw, for sending me that. That actually was the first time I'd seen that, so I appreciate you sharing that information. And the governor, of course, had specific dates, most notably the 27th and May the 1st, and he, if I'm quoting him correctly, plans on lifting the stay-at-home order. And so I know through the press release that he's working with an economic advisory group to give him, I believe, recommendations and advice on what types of businesses or how to open businesses. And also he has a healthcare advisory that is looking from surge capacity planning and so on and so forth for the state of Tennessee, which is very good and prudent, I believe. I will say at the local level, we certainly plan to follow the governor's lead on this. And as we learn more about what the governor plans on doing, of course, we will take that into consideration. Because right now it's all of us are working together on this, on the whole project and reopening, getting our communities back in business. But let me say a couple of things. I think it's important to note that where we were when the order was issued, there were many things that we didn't know as a community, particularly about the disease itself. And we knew that we did not have resources to deal with the potential what the disease was going to bring us. All we knew was what was happening in Europe, what was happening in the state of Washington at a nursing home, and the potential was certainly there. So several weeks ago, we did not have adequate PPE or personal protective equipment that our first responders need or healthcare workers need. We certainly didn't have ventilator support enough for surge capacity in our region. And we didn't have a lot of knowledge about the disease itself, how it's transmitted, and so on and so forth. So today is a different situation. We know much more about the disease than we did. The hospital or healthcare system has had time to pre-plan and plan for surge events. We do have more PPE. I'm hesitant to say adequate PPE because we don't know that yet, but we certainly have a lot more PPE than we did a few weeks ago. And we certainly have access to ventilatory support for ill patients, which we didn't have a few weeks ago. So we know also that the disease numbers or new cases, if you will, is not increased as the models predicted or as much as what we thought would happen based on the performance or based on the numbers of other areas. And I think we can compliment and applaud our citizens throughout the whole region, but we're speaking in Sullivan County and Kingsport tonight, for being so diligent. Because I think without a doubt, we can say that our citizens have been a big part of keeping our caseload down in Sullivan County. And I think the citizens and businesses and all of us can be very thankful and grateful for that, of course. So now, leading up to my point, the point is we have worked very hard as a region to build planning, supplies, PPE, and response capability in the event the disease gets much worse. We've also have a well-educated, I believe, and a community that has been told ad nauseum, social distancing, washing your hands, using the correct hygiene to help minimize spreadability of the disease. So I think a lot of things are in place that will allow us to consider opening up and allow us to consider what the governor may do, what I think he will do, and we're prepared to take that along and move forward with it. And internally, it's really going to come down to public health, isolating the disease, identifying the disease, doing contact tracing, and cluster follow-up. I know those are technical terms, but they're very, very important. They're very important to the community, how we do that. And our success for the overall region is dependent on that, quite frankly. So we're tooling up, and we're preparing for that in case we need to. So without further ado, we'll take questions, I'm sure, Mayor.
Does Dr. May want to make a presentation or just take questions?
Just take questions.
Okay.
All right, we'll take questions.
Okay, Alderman Phillips.
I have several questions, but I think a lot of the other aldermen are probably going to ask most of them. So I'll ask one that I have a specific interest in. Is do we have any timeline yet, or can you say if you're comfortable with events? Since we're starting to open back up and go through this process, do we feel like by summertime we're going to be in a position that we as a community are able to have some events? I know, Kingsport has Fun Fest, and Rax for the Tracks has moved to August, and Johnson City has Blue Plum, and Bristol's got in September they've got Rhythm and Roots. So this fall and late summer is going to be a really busy event season. And I've had a lot of people ask me how we feel about that, and I don't really have an answer. So you guys are the experts. What are your feelings on it?
Well, you're probably not going to like my answer, because we are in the third week of April, and those events are 6 to 8 weeks off, in some cases 2 or 3 months. I think we need to have better definition. We're doing countywide and in fact statewide testing of anyone that wishes to be tested, but also those that could be symptomatic. That's a capacity we haven't had in a long time up until the last few days. I think we need to understand what the governor's order is going to be. If there are limitations for gatherings of large groups of people, I think we need to know the answer to that before we can answer those types of questions. Do we know if the governor is going to use the federal guidelines, the phase 1, phase 2, and phase 3? That's unclear, at least on what we know and what the governor's plans are. And so I think we should get more of that definition in a few weeks, and hopefully we've got to be able as a region to decide and answer that question. But at this moment, I'm not sure we have the information yet.
James, do you have a follow-up?
Nope, I'm good. That was it. Thank you.
Okay. Alderman Duncan?
He's muted.
Daryl, you gotta unmute.
Yeah, I couldn't get it to unmute there for a second. Sorry about that.
Go ahead.
As we as we kind of go through this, we've heard about, trending down. And so what would it be like if we seen a trend up? I mean, what would dictate that? Would it be, 2 cases in Sullivan County, 10, 15? Because we seem like that, when we first started out, we was kind of at 3, and then we went to 5 and 10. What kind of dictates that as when it would be an alarm as we trended down? We're kind of going through these phases that you just discussed.
Well, those are the phases that I'm referencing is from the federal government's task force recommendation to the President of the United States. And those plans were disseminated to the governors. I do not know if the governor of Tennessee is using those guidelines published by the federal government. We'll wait and see what his order says, hopefully by Monday, or at least by May the 1st, we'll certainly know. So the federal guidelines are specific in that you need to have trended down new cases for 14 days consecutively. So that's a logarithmic statistic. So it's variable. That there's not a number that is the key trigger point number. It's based on your region or your state in this case. So again, going back to what the governor's order could say or may say, I think is we're really just speculating right now. But as far as Sullivan County goes, if the governor, he said that he's going to open up and lift the stay-at-home order, and so that is something that we will do likewise in Sullivan County. But the details of the phases and things are unknown at this point, how the governor's plan is going to react to that. And his council is working very hard, and certainly I want to reiterate that we're going to work with the governor's office and his administration to move forward as well.
Thank you. I guess, Gary, I was just wondering about your own opinion. What would be your alarm point as far as, trending up? I mean, have you got any thoughts on that?
When you talk about numbers and things, you have to look at what's driving the numbers. If we had an unfortunate event at an assisted living or a nursing home, that's going to drive a statistic. But more importantly, we're concerned about what's going on in that nursing home. So that's an example of how you can just focus on one number and probably not get the whole picture. You really need to see the whole mosaic, if you will, of all the statistics and what's driving those numbers before, because from a public health perspective, you really need to know what is going on with the disease and react to that more so than a specific number. May not be answering your question correctly, but that's the best answer I've got for that.
Gary, and that's a good point, I think, too, that, especially with the nursing home. So thank you so much.
Sure thing.
Sure thing.
Thank you.
Thank you.
Alderman Adler?
I just had a quick question about contact tracing. So I was listening to the news this evening, and there was a piece about the number of contact tracers that the state was hiring, I think to double the number of people that were doing contact tracing. But my understanding is that as a regional health department, we are not part of that. Is that correct? Are we hiring our own contact tracers to do that sort of work? Or can you talk a little bit about how we're going to get the number of people to be able to do contact tracing?
Actually, it's a great question and a key question as we move forward and open up, if you will, if I can use that term. So yes, we are. Currently, we have an epidemiologist nurse. We have 2 disease intervention specialists, and some other nursing that is doing contact tracing and cluster follow-up and case follow-up as well with their cases and suspect cases. And we're working with healthcare providers, infection control disease specialists in our healthcare system, and so on and so forth. And of course, we have Dr. May. And so we are almost doubling that workforce. We're advertising now for epidemiologists, disease interventionists, and epi nurse nurses, excuse me. And so we probably are a bit optimistic. I wanted to have those folks online by May the 15th, but given everything that's happened, we're going to try our best to get it done this month, and I believe we will. Most of those folks, by their credentials, are pretty competent. They're not going to require a lot of uptime for onboarding in terms of orientation and things like that. We'll hire the right folks, and so we'll have a great staff. I believe, giving our caseload, our population, that should be able to handle contact tracing. But thank you for that question.
Gary, you have a pretty good backup guy in Dr. Spivey, don't you?
We do. Dr. Stephen May, of course, is our medical director, and we tried to think just like a football team, you need 3 deep in every position. So we've contracted with Dr. Mickey Spivey to be Dr. Stephen May's backup, if you will. So Dr. Spivey's been in on all the meetings, been participating fantastically, and as a team, we're doing very well working together.
Do you have a backup,
Can I
Jennifer?
ask a follow-up question to that as well, just quickly? Hoping that the bus get sick and all of us stay well, but in terms of helping contact tracers do their job well, are there things that we can be thinking about doing if in the event that we would get sick and need to talk to someone who's a contact tracer?
Well, that's a great question, and I appreciate the question. You know, if I may, aldermen are engaged in the community. They attend a lot of community events. They see a lot of folks by the nature of your job. City manager, police officers. It's probably a good idea for citizens to keep a log in a small notebook where they've been, who they've been in contact with, and so on and so forth. And if they become exposed, or if we learn of them being a contact, or if they get sick, then we've got a traceable record that the person doing contact follow-up can accurately follow and help mitigate the disease. That would be amazing if we could get our population to do that. And Dr. May has something he may want to add to that as well.
I would just want to add that you may want to know what the definition of a contact is. And that is a person who was within 6 feet for greater than 10 minutes without any type of PPE. So that's how we define who a contact is. We make contact and we do active monitoring, which means we call them every day, ask them for their temperature logs, and ask them how they're doing and feeling. And then if they should develop any type of symptoms, we start urgent testing and place them in isolation until we define what is the cause of their illness.
Okay. Alderman Cooper.
I just have a statement. I mean, some of the questions that I had have already been asked and answered. I've been a little encouraged lately. It seems like we're kind of hovering around that 45 number of cases in Sullivan County for the last several days. And then I've read that they were 35 and recovered. So, you know, that's an encouraging number that doesn't seem it's increased a lot lately. And also, we had some discussion last night. I was glad to hear you say that we were going to follow the governor's lead and open up Sullivan County at the same rate as some of our neighboring cities and counties. I think that would be an advantage for Sullivan County to open up at the same time that Johnson City and Washington County, some of those our neighboring counties and cities open. But most of my questions have already been asked and answered, so thank you.
Let me address the point that Betsy just brought up. You know, Gary mentioned that the governor has an economic recovery task force and across the state, and we have 3 prominent members of our area that are on this task force: Eric Deaton, Danny Karst, and Nikki Burdine. And so we've got some input about our area and how our specific needs in economic recovery.
And I appreciate the point that Alderman Cooper brought up about our cases. Dr. May and all of us at Sullivan County Health Department have obviously noticed those numbers. and you can't help but get hopeful. But again, I attribute that to the diligence of our community, our citizens, and our businesses that have all made that possible. And I think good leadership from local government as well. So a lot goes into success, and I think that's where we are.
Tommy?
Most of what I've read, the leadership in this is coming from you guys and not as much from the governor on opening is what I've been told. So who's really in charge as far as y'all are concerned? And are y'all working with Johnson City and Washington County and that sort of business on the opening part? I don't know if it's going to be a true opening, a small opening, or whatever. Are we sort of coordinating our efforts together is what I'm getting at.
Well, of course, the governor is in charge.
Right.
And no doubt about that. And then our
But
mayor
there was
is in
some
charge.
way that I read that we were sort of a different.
Well, the governor decided to, in his press statement, decided to announce the 89 counties and leave the metropolitan health departments to do as they want for their community.
That's what I meant.
And yes, and that's what you're correctly referring to. Now, the metropolitan health departments are Shelby County, Memphis, Jackson, Madison, Nashville, Davidson, Chattanooga, Hamilton, Knoxville, Knox County, and Sullivan County. And those metropolitan health departments have been in existence for decades, for a lot of history reasons back then. And at times, the Sullivan County Commission has reevaluated that. Do we need a metro health department and so on? It really boils down to what is the most economical way to provide public health. That's been the deciding factor. And if you'll notice, those are the bigger population centers in the state. So 42% of Tennessee's population falls within those public health departments. So there is absolutely no question that public health needs to work with the state government in order to be successful. We need for the state to be successful, not only for Sullivan County, but Kingsport as well. So the coordination effort has been phenomenal. Yes, we meet monthly with all of our mayors in Sullivan County. Mayor Shull has been
Meeting weekly
Yeah,
with us.
been religious about meeting, at least weekly, many times more often than that, our city managers. And we've had meetings with our colleagues in Washington County. Mayor Gandy has been over to our county for meetings, and the city mayor of Johnson City, Mayor Brock, has been over as well, so electronically. And so we do coordinate as much as possible. We try to collectively be together on major decisions. And I think that accounts for the success that we're having in Northeast Tennessee and Southwest Virginia with our partners in Southwest Virginia, and the fact that we are communicating vigorously, and on key decisions we inform each other and stay together. And that's exactly how we're going to move forward, because it's brought us success, as Alderman Cooper pointed out. And I think, why would we want to vary from that? Let's stick together in a coordinated, coherent way, work with the governor, work with the state, and move together as a region.
Gary, let me add to your point. The city manager and I had a teleconference this morning with the city manager counterparts and my counterparts from Sullivan County, Washington County, the three Tri-Cities. We even had Elizabeth in with us. And we couldn't get into specifics as to what things are going to look like in May, for instance, because the governor hasn't given any detailed guidance yet. But we did pledge to work together on this. As the board knows, we have so many people that live in one of the Tri-Cities and works in the other, you know, and so we wanted to be together on this. We know that we will implement the governor's guidance. You know, that's what we have to do, the minimum. We have to follow his guidance. And more to come on this as the governor releases more information. Let's see. Did you have a follow-up, Tommy?
No,
Okay.
I do not.
Okay, Vice Mayor? There's the
I've got a couple of questions. One, I know we've just done a lot of tests. How many tests were done now that we have kind of opened it up to people without symptoms?
Okay, I tell you, I've been talking to so many businesses from Bristol to Kingsport today. I haven't had time to even ask how many we've tested. I'm going to see if Dr. May knows. You may know.
We're still ramping up the testing at the health department. Yes, Monday was our first drive-through clinic. We were able to do 67 easily. We ramped up today to 97 and continue to try to increase that throughput as they go through our health departments. And then we're still continuing acute illness checks through the Kingsport Health Department. So probably 100 today, 70 or so yesterday.
With the increase in testing, I would say our percentage will probably drop, but our numbers may go up. Is that what you're anticipating, being that a lot of these people don't really have symptoms but just want to be tested? Is that what we're looking at, or?
That's certainly a possibility because we are testing a lot of people who are asymptomatic and may not be sick at all. However, our goal is to have a better understanding of the disease as it penetrates into the population, and then to also be able to identify, well, what is the percentage of those who are asymptomatic yet may be secreting the virus, thus being infectious. So this is the type of data that we'll gather through this mass testing campaign.
They've talked a lot about the antibody test, and I know we don't have it available but right now, and I assume when you do have that available, that 7 million people in Tennessee will want to take that test, because we'd all like to think we've already had this, and therefore we're safe. What are you all thinking in terms of when you're going to get it? If you're going to get a lot of kits, how fast they're going to be checking the results of those versus the results of what we're currently doing? Because I can't imagine that we've got that many people to be available to read the results.
Well, we'll be looking at, first of all, looking at availability of the test. There are currently over 70 different tests on the market, looking at the antibodies that may allude to immunity. Only 4 have been approved by the FDA, and we're still concerned about, well, just how sensitive and how specific are they in their results. Eventually, I think there'll be a ubiquitous test. I think it will be a point of care test. As to whether that means long-term immunity, that remains to be seen. When I talk about long-term, I'm talking about greater than 2 years. So we'll have to get these tests, study, see what happens over time. We do not have these tests yet widespread in Tennessee, and I think it would be wise to wait till we've got good tests rather than using tests that may not be as accurate as we would like.
You've said you've learned a lot about this disease now, considered, from where we started. Does the data show that warmer weather will help, or is the data just simply showing that we've done better with social distancing and we've done the things to prevent it? It's not something that maybe like the flu, that warm weather will help.
I think that depends on your geographic location. If you're in New York City, you're certainly not going to say that, although they're starting to see a decline. If you're in Nashville area, you're certainly not going to say that, because their numbers continue to rise daily. I think we can relate most of our outcome to effective social distancing. It is helpful that the confounders of other diseases are going down, such as flu is falling back down to near its baseline. The other respiratory viruses are disappearing. So when we do see a respiratory illness now, I can say with a higher degree of confidence that it most likely is COVID-19 and not the flu not the other rhinoviruses and other viruses that we deal with every day. So summertime makes it easier. As we get into fall and these viruses make their resurgence along with possibly COVID-19, then we're going to have that rapid testing to separate out, well, is this flu, is this COVID-19? And that's where the antibody testing that we do at a point of care will make such a difference as we get later on into the fall season.
My other question, I don't know what information you all can provide. I mean, I think a lot of the public is basically believing what's on Facebook in terms of how many people are in the hospital, how many people are on ventilators in this area, and they have a lot of belief that we have every single person that has it has been in the hospital and been on a ventilator. I mean, they're pushing this to worst case, and I don't know what information you can give. Can you give a number of Sullivan County residents that are currently in the hospital, or is that not?
Yes, we currently have 3 in the hospital that are critical and on ventilators. The statistics for recovered, though, and the total number of cases and the total number of tests that have been administered are listed daily, updated every day at 3 o'clock on the TDH website.
Well, I'm getting there. I just wanted to know if, how severe we had people. And I think that's all my questions. Thank you very much.
Okay, Gary, I'm glad you brought up the hospital. I had a conversation with one of the key leaders from the hospital, and I'm trying not to speak for the hospital. I just want to indicate that I felt pretty good about where they stand based on talking to them. They have the surge capacity right now. They tested over 100 people yesterday, and every one of them was positive. I mean, not positive, no positives yesterday. The fear they have, and I can understand this, would be that what if this virus were to get in one of the elder care facilities, assisted living, nursing home, that type of thing. And so far we've prevented that. And they attribute that to good social distancing and all the basics here that are in the guidelines that the president provided. Dr. Burks briefed a few nights ago. They're going to stay in effect as far as what individuals do: maintain social distance, do proper hygiene, and so forth, so on. So I guess my question is you think it right now that you agree that the hospitals could surge if it had to, putting the nursing home kind of issues aside?
Well, we share those concerns as well. And there are many concerns that we have with COVID-19. Nursing home assisted living needs to maintain their diligence, and they are doing a good job, as the numbers tell us. It's easy to be complacent for all of us, and complacency will be our enemy as we move forward. It will be because of our success. It's easy to forget that the disease is still there. So we're concerned about our nursing homes. We're concerned about our first responders, our police, fire, and EMS. EMS especially is exposed to this in tight quarters in the back of an ambulance that's about the size of a closet, and doing evasive procedures and doing things with critically ill patients. And so we have that concern. We have concerns as far as what public health forms super spreader. Somebody that has the disease, that may be asymptomatic, that does a lot of socializing, and maybe doesn't practice social distancing, and then it's a super spreader, and then a lot of folks get sick. So all of those things really boil down to fundamental public health practice, and that's why we're tooling up, as we mentioned with Alderman Adler. And so we're going to put those tools in place, build that capacity, and move forward.
So someone could display no symptoms, but have and not had a test, but be positive, and if they were to get into a nursing home to visit grandmother or whatever, it could get started.
Your description is possible, that's correct.
Okay, board members, any other questions y'all have for Gary or Dr. May? Dr. May? City manager?
I'll just reiterate what has been said. Greatly appreciate the work you guys have done. I think it goes without saying that you guys have been busy for several weeks, and we know that's not over, and you got a lot of work ahead. But I greatly appreciate what you guys have done. Greatly appreciate the communication back to myself as well as other folks across the county. I know it's been extremely helpful in helping us make decisions. And definitely as we get through this week, we get an idea of what the governor's plan looks like and how we're going to reopen. I know you guys are going to be communicating with us, and we just greatly appreciate that feedback that we have. So thanks.
Thank you. I appreciate your support as well.
I think the vice mayor made a great point. This is a very serious situation, but we also don't want to unduly alarm people. If they just follow the social distancing and wear a mask when you go to the grocery store, that kind of thing, it's already been proved to help out a lot in terms of keeping this thing down. So I appreciate y'all coming. Thanks a lot.
Hey, Gary, let me ask you something. By being a diabetic.
Oh, you want me to step here?
Yeah, by being a diabetic, which I've been for years, would you think, even though I've had no symptoms or anything, do you think I ought to go through and have the test and because I'm a diabetic? Would you suggest?
How about I'll let Dr. give you good advice?
Yeah, that's good.
One of our
This
first rules
personal
in medicine
question.
is to do no harm. So getting the test will not harm you. It will reassure you for today. It will not change the fact that you may pick it up tomorrow, the next day, or the next week. This is a virus test. And this is where the antibody test will be so valuable, in that we'll be able to say, well, you were exposed, your body responded, and you may have some element of protection for it. Being diabetic and being in the older age groups, I'll assume older than 60, I'll be kind.
Yeah, a little bit. A little bit.
You are at increased risk. Certainly anyone with cardiovascular disease, diabetes, hypertension, and obesity are all at increased risk for complications from COVID-19. And when we look at the deaths, almost every one of them have had one of those comorbidities associated with their complications.
Well, thanks.
All right.
I appreciate it.
Thank you.
I was a very small child when Tommy was playing football.
No.
That was back in the dark
Another
age.
question.
Thank you, Mayor.
Another question?
Hey, thanks for coming, guys. We
Thank you.
appreciate it.
Nice to see you.
Yes, yeah.
Did you have a question?
Y'all good on questions?